Organized money.
So, in this episode, we are going to be talking to a dentist. And I know that every time I go to my dentist, the distinguishing features are that he plays classic rock and he hums every song while he's working on my teeth. And so I leave the dentist thinking about ELO and Foghat and all these great bands of the 70s. And what I'm not thinking about is who owns this practice and is this guy, is whoever the owner is giving the advice that I need to make sure that I'm not being overcharged or they're doing the right thing in my mouth.
I agree with that. The thing about dentistry is it's kind of one of the only professions or services that I consume today that's pretty similar in terms of the experience than it was when I was a kid.
Like an independent business where there's a guy who is
Right.
obviously a professional, but he's also a small business owner, and it seems like he's in control of what's going to happen with that practice and with your health.
So we have a great guest to talk about the threats to this way of doing dentistry. So it's Jill Tanzi, who is the founding member and president of the Alliance of Independent Dentists. She's also a practicing dentist herself, and she has a great perspective on the political threats to the independent practice of dentistry. Why, in fact, a lot of the dentists that that are out there, one you may go to, are not actually independent and may be controlled by a corporate entity that doesn't have your best interests in heart. So we had a great conversation with her. Organized money. Jill, thank you for joining.
Thank you for having me.
So you are part of this large group in America that's sort of undefined politically, like people who are healthcare workers, but also entrepreneurial business people. So this would be, pharmacists, doctors, dentists, people who traditionally maybe run their own practice, but they also employ people and they make money, they do it for profit, but then they're taking care of patients, right? So it doesn't really fit neatly in anyone's political framework. But everybody goes to the dentist, right? So
Mhm.
everybody kind of knows well, yeah, you're shaking your head,
Almost
but
everybody.
everybody should go to the dentist. Um, when you got into the business in 2000, what was the business of dentistry like? And then how has it changed over time?
So back in 2000, I think things were already changing. So you could still open your own practice. You can still do that now. It's just a little more difficult, a little more expensive. You're not back in 2000, maybe we weren't coming out with as many school loans. But
Mhm.
I feel like the difference between 2000 and now is huge compared to the difference between 2000 and like 1980. It's completely different. There's so many players in this space that want a piece of the pie, and I know where it's coming from. They are copying medicine, and so I'm sure you know that our medical system is totally gone bad in this country. There's a lot of good things, but there's too many people taking a piece of the pie here. And it's not just patients and doctors anymore.
But let's just get to the basics of it. So
Yeah.
when you open your own practice,
Mhm.
people come in and they just pay you, or is dental insurance a big part of it? Like what was it like when you started, or maybe go back to the early 80s and put yourself in that mindset? And then what's it like
Yeah.
now?
So back in the 80s, I didn't practice, but I know that dental insurance was probably getting to be a big part back then. And it was based on what we charged. So they would pay either a portion or, all of what the dentist charged. And it was based off of what the fees were in the free market in that area. So you jump to 2000, maybe change a little bit more restrictive, more people taking dental insurance, maybe some insurance companies becoming more of a monopoly. And then fast forward maybe to 2010, at least around then in my state, um, it totally changed. Like the fees they were using weren't based off of the averages for the area. So dental insurers just coming up with random fees that they would pay you, just kind of out of nowhere, or just dropping the fees dramatically. Certain companies getting much larger than other companies in the space, so they can pretty much dictate terms any way they want. So that's the big difference with dental insurance right now.
And where are you located, Jill?
I am in Hopkinton, Massachusetts, which is where the Boston Marathon starts.
Oh, excellent. So, I mean, there are two things that you're talking about there. One is the insurance side, and one
Mhm.
is the actual practices.
Right.
So let's start with the practices. I mean, I think my entire life I've been going to individual practices, although I probably don't know that they're owned by somebody else. As far as I know,
You might
they're
not know because they
individual
don't have to
practices.
disclose that information to you.
There you go. There you
Yeah.
go. But I've been to practices that have multiple dentists working there. I've been to individual practices. Um, and at what point did, investment groups decide, hey, this might be a good concept for us to get involved in?
I think in the past 10 years, we've seen a huge amount of investors, DSOs, dental service organizations, come and try to buy individual practices. And these DSOs are many times owned by private equity, or will be owned by private equity. And it's just becoming the norm now. Do you sell to an individual dentist, or do you sell to one of these larger groups when you retire?
So walk us through let's just get away from the changes in the politics for a second. Walk us through, like, if you were just explaining to somebody who knows nothing about dentistry, has never been to a dentist, doesn't have teeth, whatever. Like, they say, what do you do and how does it work? Like, explain, like, you have patients that come in, how do they pay? What,
Mhm.
is it, how do you treat most of them? Like, what is the business?
So if you know nothing, if you're a patient and you need your teeth fixed, if you're having a problem, or if you don't have teeth and you want teeth, you go to a dentist and you come in. You might have dental insurance, you might not. We charge a fee. You pay a copay. You may pay all of it if you don't have insurance, and then you get teeth.
Right. And
Uh,
in the 80s, it was pretty much a cash, everybody paid cash and there was really
They
no insurance
I wouldn't
or
say there was nothing back then, because I do remember my parents having an insurance, dental insurance, and maybe they were on the earlier cusp of that, but
and
they did have dental insurance.
was dental insurance always split from health insurance? Was it
Yes.
always sort of two separate businesses?
As
Okay.
far as I know, it's always been split. And people have asked, why isn't dental
Right.
covered under my medical plan? You hear it all the time.
Right.
And somebody asked me this question once, a professor at one of these prestigious universities, and I said, do you really want it to be? Medical is so messed up right now. Like, why
Right.
do we want to add dental to it? Dental's still relatively affordable. Not for maybe everybody, but
But
basic
it,
preventative care is nowhere near what medical care costs.
but it is kind of wild that we have health insurance, except not for a
Right.
couple parts of the body. I mean, Medicare doesn't have dental insurance. You have to get that separately, right? It's just very strange
Mhm.
that we're gonna give you insurance that's gonna protect your whole body, but not from the chin up. We're not gonna deal with that. You got to work on that on your own.
You're right. And preventative dental care is not terribly expensive compared to medical care. It's
Right.
when you're not doing the prevention or not taking care of yourself that you're running into big expensive procedures.
Right. It's vital, and it affects other parts
well,
of your health.
but I want to get back to me in this case. You guys are
Of
talking about
course.
what's
Of
good for other
course.
people, but my experience, I pay cash to go and get my teeth dealt with. And I didn't, I used to, because I looked in my dental insurance and all of the dentists had like terrible reviews in
Mhm.
in my area, right? And I was like, okay, this is very weird. This dental insurance is a weird thing. And so I went to a dentist that I trusted, and it's not that expensive to pay cash. So that's what I do. And even when you do have dental insurance, it's like, if you need something big happened, it can be very expensive.
Mhm.
Um, it feels like the kind of increasing corporatization of dentistry, or something has happened over the last 20 years or something, that made the situation with dentistry much worse, more expensive or less trustworthy, like less of a profession. Is that a fair characterization, or is my experience just seeing like, I have this thing called dental insurance, but you can only go to these entities that have really bad reviews with people saying how bad that dentist was?
Yeah, so I think this is a product of dental insurance not really being insurance, and it's
Hmm.
covering very limited things. And it's more of like, how many dentists can we control? How much money of these premiums can we hold on to? And that's just not good for anyone. It's not like medical insurance where if you need a substantial procedure that it's going to even be remotely covered, there's always a 1,000 and 2,000 maximum. So it's really just like a coupon, and they're telling you where to go with this coupon.
But it's like a discount card,
Yeah,
right? Yeah.
yeah,
Um,
yeah. But we call it
And
insurance, but it's not really insurance.
this is a podcast about monopolies and corporate dominance, and I'm going to shock the audience right now by informing them that there is one dominant dental insurer, particularly in some states, maybe the only dental insurer. So tell me about Delta Dental.
Well, Delta Dental was the one I was thinking of when, you know, I assumed that dental insurance would be paying based on an average fee in an area, and that isn't true. It's some of them actually still do that, but Delta Dental will just keep dropping fees, picking random fees. I testified against them at the Division of Insurance. I couldn't even follow their numbers or math or um, so they're definitely a monopoly in my eyes. They have a control, and whenever you control a market, you can kind of set your price. And
Right. Now, are they the only insurer in Massachusetts, or they're a
no,
primary one? They're a
they're the
primary.
primary one, yeah. But
Right. Okay.
there are others. There's Blue
how
Cross.
how important is insurance for your business? Right?
Mhm.
Like if there are some people who will come in, and if they have a relationship with you and they trust you, they'll pay cash. But if it's like, if you don't take Delta Dental, are you out of business, or can you make it without taking those guys?
Well, you're definitely not out of business because I don't take Delta Dental. I stopped during COVID, and just because I was looking ahead, thinking there's probably going to be inflation. I can't control any of my fees. It takes 6 months to get out. I panicked. I dropped it. Um, it's more convenient for patients for you to take it, but because there are other insurers in the
Right.
marketplace in Massachusetts, and because I have cash patients, and because I've been practicing for 25 years, and I can explain this to patients, I was successful. But not all offices can do that, and
Yeah.
it can be really difficult.
Interesting. So when we're talking about Delta Dental, there's kind of an association or a parallel between them and say United Health. United Health, as a health insurer, also is the largest employer of doctors in the country.
Hmm.
Uh, Delta Dental, I understand, also, do they own dental practices? Do
They
they own
do.
other? Okay, so tell me about that.
So back in the old days, they actually owned one in the town next to where I practice. Not too many people knew about it, but it was owned by Delta Dental, but it was a subsidiary of Delta Dental called DentaQuest, and they were helping run the Medicaid program in Massachusetts. But they have so many subsidiaries, it's just hard to keep track. But I knew they were owned by dental
Mhm.
insurer, and eventually they sold. Like I don't think they own that practice anymore. But most recently in Wisconsin, Delta Dental has bought a large group of practices. I think it's 40 dental practices called
Mm.
Cherry Tree Dental. And I know there's some hearings right now to see if this will actually go through and what the terms will be. But that's pretty scary to me as a dentist and also as a patient to think that we're going down the same road as United Healthcare and medicine.
So what exactly is wrong with a dental insurer buying a bunch of dental practices, whether it's Cherry Tree or others, because it's not just happening in Wisconsin, it's happening everywhere.
So if you go through the exercise in your brain about being the patient and you're needing treatment and you're going to an office for treatment owned by a dental insurer, do you think you're going to get what you really need or what they think you need? They're not dentists.
Is
Oh, okay.
is
Problem.
is there prior authorization or things like that in the dental field the way there is in health insurance?
I would say there is, but we're not held to that same
So
standard.
it's not as
It's not
rigid.
as it's not as rigid in
Okay.
dental. You could not send one and it would still be covered, but you might have to send additional documents, and there's a chance that it may not be covered. So sometimes we do it
Okay.
just to make sure.
So what are the ways that a Delta Dental or just any dental insurer kind of shapes the type of treatment that a patient might get?
They might say, and it's not just the dental insurance company, it's sometimes what the employer picked for the plan.
Hmm.
So you may need an implant and it may be the last tooth in your arch, and they say, sorry, we don't cover that. That's not
I
a
see. So it's more
reason.
through
Like,
exclusions and things like
yeah,
that.
So,
often, it's the employer too. It's not just the insurance
Right,
company.
right, right.
Mhm.
um, have have prices gone up in the last, I don't know, 15 years or so since this corporatization wave really took off?
Yeah, I think prices for everything has gone up. But dental insurance reimbursements have not gone up, and in some cases they've gone down. And sometimes they've gone up, but just not enough, not the same as inflation or cost of living increases.
So, okay, now we've been talking about consolidation and the acquisition of these practices, and really it's finance coming into dentistry. And you said, they're not dentists who are making decisions about dental insurance. I know there are corporate practice of dentistry laws that ostensibly prohibit the corporate ownership of dental practices, at least in some states. There are those laws in for doctors and veterinarians as well, but they don't. There are significant problems. We did a show on what happened in Oregon, where they actually added teeth to those laws. If there is all of this consolidation, how are these non-dentists buying up all of these dental practices? What's the mechanism they use to do that?
So what they do is they call themselves dental service organizations, and this is for the run-of-the-mill type of non-dentist. It's not an insurer necessarily. Um, they will say they don't own the practice, but they just manage the practice. But I feel like there should be some kind of litmus test that can doctors sell the practice? Can they fire the management company? And that's not usually the case.
And they
I just
set the dental services organization manages pricing, manages care plan
Yeah.
treatment, and the
And
yeah, okay.
they own the practice. They say they don't, that they manage the practice.
Hey,
But they do own the practice.
it's all about service. It's just
Mhm.
all about service, and they're providing it. That's interesting. Okay, so you're talking about kind of a squeeze when you're talking about the practitioner itself. So the insurer is attempting to exclude certain coverages and treatments and dictate what they'll pay for. And then these on the other side, in terms of the ownership, the dental service organization is also trying to lower costs, change the ways that the practice operates. And the dentist and the patients are kind of in the middle.
Mhm.
What effect has this had on the quality of service that Americans are getting from dentists?
Well, it's hard to want to generalize about that because it's really based on the dentist you have. But then you think about who do the DSOs hire? They're hiring more inexperienced dentists that are coming out of schools, and they have to get jobs too. But maybe they don't have that same mentorship.
That's because it's
Um,
cheaper to hire those kinds of dentists?
yeah,
Okay.
yep. So, and they don't stay in those positions always that very long. So they may be going into private practice later. So they're not really getting a lot of mentorship for the most part. And that might affect patients going to a DSO where it's you're not always getting the best care there. Um, we don't
Hmm.
always like to say that, but it is true. I've seen treatment plans from DSOs where they're padding, they tend to take a lot of insurances, and they pad it with costs that aren't covered by insurance. So a lot of nickel and diming, a lot of padding.
Hmm.
I've seen some other things where maybe they want to do tons of baby teeth crowns, and they've come to me for a second opinion, and maybe they need like one filling, and it's pretty sad.
So what are like if you go to the dentist, right?
Mhm.
And not really paying that much attention. It took me a while to figure out, oh, I really should go to a dentist I trust. What are some of the, you said they do a lot of, some of these entities, they do padding, right? What are
Mhm.
some of the things they do, like as a consumer, that you should be watching out for?
You should watch out for whenever maybe you need a filling, they might add random fees for each procedure that you're getting done that are maybe between 50 and $100, just a lot of these little fees, like liners and there's all sorts of little things they can come up with, like Arrestin is one thing that's like antimicrobial we squirt under the gums. Like if you see like 10
Oh
times they're going
yeah.
to charge you this. It's not usually it's just a patter. Like it's because they're taking a lower reimbursement from insurance companies to get you in the door. They're trying to add more things to make up for the loss of taking that bad insurance plan.
Sort of like the junk fee thing. I mean, one of the things I saw that was incredibly creepy were the takeovers of these dental practices for kids and
Mhm.
doing, all of this stuff on baby teeth,
Yeah.
often causing serious harm for teeth that kids are going to lose anyway that they don't need.
Well,
I mean,
you
I
do
don't
have
know.
to treat them, but I've seen just like out of control treatment plans from
Like
places like that.
unnecessary things.
Unnecessary, and it's like a little kid, and you're traumatizing them, or you're putting them under, which is risky. And yeah, I would really steer clear of those places.
So
So
if you need treatment, so this is just something that I think will be useful to our listeners. If you're having problems with your teeth and you go to your dentist, how do you know that they're giving you good advice? Like, let's say you don't know your dentist very well. How do they
Okay.
know you're giving you good advice, that they're telling you what you really need, or that they might be telling you what you don't need, but something that might be more profitable, or that they might get better reimbursement rates? Like, should you get a second opinion on anything major? Like, what should you do?
I really think you should, especially if you don't have a good gut feeling about it, or you don't have any feeling about it, or you don't have any recommendations from friends. You should definitely get a second opinion. Um,
mm,
I think most dentists are pretty ethical and reputable, but if something doesn't feel right to you, you should definitely get a second opinion.
I mean, that's the thing. We don't want to make this about the dentist pushing something on you. They're less in charge than they would be if they own their own practice. You're talking about
Mhm.
these.
We've heard of quotas,
Uh-huh, uh-huh.
totally unethical. Like, I don't
You have
do that in
you
my
have to
practice.
do X amount of
Yeah.
crowns a week. You have
Yeah.
to do, yeah.
Is there an ethical code for dentistry, like the Hippocratic Oath for doctors? Is there something similar?
Yeah. We have like a little, I don't remember what year we do like a little oath, but
Right.
There's like
maybe at graduation. Yeah.
ethical guidelines. I mean, that
So,
actually is one of those things for actually for pharmacists and lawyers and doctors and
Yeah,
kind of professions, right?
we take an
yeah.
ethics course in school, and then I know in Massachusetts we have to take an ethics exam before we practice, but yeah.
So, so we should talk about, who these dental service organizations, like who are the DSOs? What kind of investors are we talking about? And I know that we previously mentioned how Delta Dental was buying a dental practice, and so obviously there's a conflict there if your insurer is also your dentist, and what they're going to allow, et cetera, or what they're going to steer you into. But the Private Equity Stakeholder Project did a study recently, and they said in 2024, there were at least 161 private equity deals in the dental healthcare sector. And that was up 10% year over year, and more than any other healthcare sector there is. So it seems like private equity has found out about dentistry, which is always kind of a whoops. Like they figured us out. There's another area they want to roll up. Is that a real problem within dentistry now? Do you talk to other dentists about that, about private equity's involvement in the space?
Oh yeah, we talk about that all the time, and we don't think it's a good thing for consumers or our patients. They're focused on money and how are they going to resell this business to make their money in 5 to 7 years. That's their timeline.
Right.
They're looking that they don't typically hold practices for a really long time like a dentist would.
Yeah, I remember I have a relative who was a dentist, and he had the practice for, I don't know, 30 years. And then when he wanted to retire, he had to find a dentist who was
Mhm.
willing to take the practice and take all the patients and do a seamless kind of transition. So it's the same business, just with a different dentist.
Mhm.
But in a private equity context, it's an endless flip. It's not 30 years.
Right.
That's not the timeline.
And typically, if they buy your practice, they don't want you to leave right away. They want you to stay for 5 years.
Mm.
Do
So
they
they'll,
do they have non-competes?
um, yeah.
Like, do you have to sign? Okay, I'm assuming that you would.
Yeah. And I've heard of non-competes. You have to be really careful too, because it may be a non-compete just for your area where your practice is, but if they own several, it could be from any distance from any of those practices.
So you are the
Mm.
president of the Alliance of Independent Dentists, and
Yeah.
tell me what your organization is working towards, and how you're working to try to improve the conditions in this industry.
So we started in Massachusetts, mainly battling insurance companies back in the day,
Okay.
but we've morphed into a national organization that educates dentists and patients about why it's best to see an independent dentist and why it's best for all of us that most practices remain independent.
Right.
And is there a map? Do you have a map or something where people can find independent dentists in their area?
Yes, at our website, dentistalliance.org, there is a place where you can search to see if your dentist is independent. Not everyone's in there yet, but we're slowly building this directory so that patients can find this out. Because as private equity gets involved, they've learned that they don't want a group of practices to sound like a chain. They keep the name of the original owner.
Mm.
Yeah, my wife went to this dentist practice that had like it was super, like really like colorful, and they had, you go in and they give you like they have free toothbrushes everywhere. You could just brush your teeth while the waiting room, and it looked. And I was like, to me that just sounded like a scam. And she was like, no, it's really nice. And then she actually needed something done, and it's like clear that it's like a private it's a corporate practice, right? And
Mhm.
she's like, okay, this doesn't seem right. Um, and
I'm
that's
doing
like,
this right now. I'm on the website right now, and I put in the name of my dentist, and I'm not seeing him there. And he's going to get a phone call from me.
well, it strikes me that when I'm talking to you and you're like, oh, it's like not as it's more flexible than health insurance. They're not really like they're trying to impose control, but and they are successfully doing, but you can still start a practice. And it sounds to me a lot less advanced in terms of consolidation than a lot of other industries.
Mhm.
And it sounds to me like it's still working pretty well.
It
Um,
is right now, but hopefully we can leave this organization to some younger dentists that want to keep it alive. And
Yeah.
I think people see a lot of opportunity in the dental space because it hasn't been totally vertically integrated. And
Yeah, I think that's
yeah,
yeah.
there's a lot of
I
opportunity there.
That's the
and
thing, Matt. It's like it's nascent consolidation,
right. No, I mean
and
it
that's yeah,
I'm not saying we don't have anything to worry about. I'm saying it's
yeah,
like it's kind of, it's fascinating because the what you're essentially saying is there's been a lack of professionalization and tightening in the people who are trying to take over dentistry. And
Mhm.
so you guys are still free to deliver reasonably, not free. I mean, not totally. The number of independent dentists has declined dramatically since 2000. It's not, the trends aren't good, but it's just kind of interesting because you don't really talk to doctors who feel that way anymore, or physical
Right.
therapists or anyone else.
No,
They're just like, yeah,
80%. I think it's around 80% of dentists are still independent.
oh, okay. So, well, okay. So there are really serious dental like shortages of dentists, especially in
Mhm.
rural areas. Is that a new thing? Is that gotten worse? Is that getting better? Is there what's causing that? Tens of
Well,
millions of Americans. I mean, I don't want the US
yeah.
to turn into Britain with the stereotype of the bad teeth. Um,
I think it's hard with rural areas. I think they've seen their own populations decline, so it's hard to get a dentist to go there because
yeah,
maybe there's not enough people to even have a business. I
yeah.
do know people that practice in some rural areas in Massachusetts, but Massachusetts is a smaller state, so you don't
mhm.
necessarily have to live in a rural area to practice in a rural area.
It's about
Um,
attracting
yeah.
those professionals. But
And
I mean, it's
if
even
you're in a big
true.
state, you may have to drive a really long way to get
Yeah,
to the rural area.
but it's even true in more urban settings. I remember going a year. This was years ago, but going to a remote area medical
Mhm.
presentation where they just drop a bunch of doctors and dentists and whatever. This was at the LA Sports Arena, like a huge, like 15,000 seat arena, and they had this event on the floor of the arena, and people who hadn't gotten because they couldn't afford it, hadn't gotten any kind of dental work done in years or decades, maybe, were just lined up, 20 deep, 30 deep. So the shortage issue, I think, is an affordability issue in addition to an
Mhm.
access issue.
Totally. And I always think the best solution for that are like maybe government clinics in addition to people taking
Sounds like
Medicaid. And
socialism to me. I don't know.
not socialism, but
Yeah.
it's a nice way to maybe give people a reduction on their student loans, get them to go there for a year or two, almost
Right.
like military service. Like
That's
you're
actually
helping
really,
some,
that's
you're
really
helping someone,
interesting.
you're learning your skills, you're not having to work for a DSO. You're working to help people, and I think we used to
Yeah.
have something more like that, but
Well, there's a
you're paying them a
version
Wait,
of it.
really?
salary.
Wait. Tell me about that.
What do you mean
We
we
used to
used to
have,
have
yeah.
something like
Yeah, I think there were more clinics. I know in the city I grew up near Worcester, Mass, there used to be a dental clinic at the hospital. So,
I mean, the one thing you just talked about with regard to student loans, there is, the public service loan forgiveness program,
mhm,
which for a while was allowing medical residents, I don't know about dental residents, but or dental people in dental school, it was allowing medical residents to, take those years that they spend in residency off of their student loans. And the
mhm,
recent reconciliation bill by the Republicans actually took away medical residents for that time to count as part of the public service loan forgiveness, which is when, after 10 years of that kind of service in government work or public
mhm.
service work, you'd get your loans eliminated. But you're saying like that would probably be a good idea if you want to expand access in,
It's
area
like
underserved
everyone
areas.
wins in that situation.
Right. Yeah. The dentist obviously is getting their loans declined and forgiven. They pay for 10 years and the community gets a dentist.
Mhm.
Okay, how do we make dentistry great again? Right? Like at what if you could just on a policy level, right?
Mhm.
Aside from having awesome dentists everywhere, um, do we, do we close the loopholes in the corporate practice of medicine laws? Do we strengthen merger? Like, what do you have more funding? Like, what do you think we need to do to protect independent dentistry and expand it?
I think number one is the corporate practice of medicine laws. They already exist, so why don't we
Yeah.
enforce those first?
Mhm.
In fact, I think Wisconsin does not have that exact law. It's a watered down version of that law. So that's why this Delta Dental can buy the practices there.
Mm. So, stopping the financialization of dentistry, stopping these financiers from coming into the business and running it on their terms rather than on, public health needs or the needs of patients.
I often wondered if, so they, in some states, they need to have a dental director listed
Hmm.
as, I don't remember where they list it, but they have to say there's a dental director, and they're just managing the practice. So if
Hmm.
that dental director could say, I'm firing this management company, which should be under their scope of things that they can do as a director, maybe we would see less of this.
I
But
see. And that dental director has to be like a
mhm.
practicing board certified dentist. Okay.
Right. But
So
that's what they do. That's what United Health Group does. They have a straw doctor who's like
Yeah, they have a
ostensibly in
fake
charge, and
doctor. Yeah.
that's just the standard, but they have no actual power over the
Right.
policy. But so one of the things that's interesting about the situation with dentists is that the Republicans in the House, so Kathy McMorris Rogers and Brett Guthrie from Kentucky, in 2024, they asked the Government Accountability Office to do a study to investigate consolidation, vertical integration in the industry. What do you expect them to find? And then is there a federal thing that should be done? Because we're talking about the state laws, but is there something on a federal level that could be done?
I have no idea about
Oh, okay. All
Yeah.
right. Sorry.
We'll move on from that.
Medicine or dentistry?
Dentistry,
Dentistry.
from what I understand.
So
Well,
I didn't know they were looking into that.
yeah, you know what? Let's just take this
I
question.
mean,
Okay.
it just
No,
kind
but
of it does.
I'm curious about it because I didn't know
Yeah.
that.
We'll take that. We'll take
Well,
that
what are
out.
you do? What are you doing? You're a dentist, right? You should be on top of everything that happens in Congress. That's what the
Right.
job of dentistry is. It's very painful,
Exactly.
right?
So no,
This is.
tell me that again. I want to write it down.
I mean, that's the thing, though, that because you're a dentist, but also, a small business person, you have to keep tabs on so many things that are outside of your core teaching and training, which is to make sure people's teeth are healthy.
Right.
Yeah, I mean, I'm a writer, which means that I don't have to do anything except pay attention to this kind of stuff. So, I don't have any skills, nor do I have any ethical requirements.
I can
So
vouch
I'm
for that.
free.
That's absolutely true.
I'm taking over your practice.
Well, it's
And I think
funny.
I'm going to make it good. I think I'm going to really do a good job.
So like back to the politics of this a little bit.
Mhm.
Any dentist on any side of the political spectrum will pretty much agree with each other on these topics.
Right.
Yeah, that is
That's
what we find.
I
It's like,
mean, these were two Republicans that put together this inquiry with the
Mhm.
Government Accountability Office. And, we're talking about rural areas, obviously, often Republican heavy,
Mhm.
that are, losing access to dentists. And so, everybody has teeth. So
I
it's a
know, no, it
bipartisan
is
concern.
important. It is important to get back to hating each other. Okay, can we
Right.
focus? Let's not focus on what we agree on,
Yeah.
obvious problems. Let's
We need,
focus on silly ways that we hate each other. I think
Did
right.
that's
you
really
see
Good
that
point.
in Arkansas they what did they do? It was pharmacy benefit managers,
Yes.
PBMs,
Yes.
we did
the
see that.
outlawed
We
PBMs.
talked about that on the show. Um,
And then a judge halted it
right.
temporarily. We'll see. But yeah,
Yeah.
this
Okay.
is it's a huge deal. And one of the cool things about, well, so we do this podcast, but we write about monopoly questions and think about monopoly questions in general, is the tactics and tricks are pretty similar across the different
Yeah.
industries. So
Like,
the vertical integration and the way that the dental practice wants to control the dental insurer wants to control the dental practices. But I also wonder, I guess this is the last question, is there when you're buying dental supplies like fillings and stuff like that, are you do you have like a good choices there? Is there an entity that you have to deal with in terms of, there's one distributor like an Amazon of that, or like because I heard some rumors about that and I just kind of didn't follow up. But I know that it's bad in like hearing aids, right? Which is another, audiologists are another one of these. How is that for dental fillings and things like that?
So it depends on what you're buying, but there are like the big three companies in dentistry, and I
What are the
think
big three? Who are the big three?
Dentsply, Sirona, Henry Schein, Benco.
It's always good to know a new big three.
There's a big antitrust case. There was a big
There
antitrust
was.
decision with Dentsply, but I don't know anything about it. But I agree.
And I think there was some collusion between, I don't know if it was all three, but they were basically inflating prices, but
Mm,
I don't know what really happened in the end. I didn't see any
right.
monies, but
Well, it's
yeah,
just that as long as there's creeping monopolization on both sides of the
yeah.
market, then we can be comfortable, right?
Right.
We'll feel
Right.
we'll
Let's
feel
have them
okay about
battle
it.
it out.
For most things we buy,
Professional move.
there is some competition.
Hmm.
I find with bigger equipment, it's harder.
Hmm.
But I think we're starting to see a little bit more competition, which is great. It's really hard when they control everything, especially even repairs, people coming into your office repairing things.
No, I'm going to take that slight sliver of hope and end the show on that. Jill Tanzi is the founding member and current president of the Alliance of Independent Dentists and a co-owner of the consulting firm Shiro Dental Advisors and a general dentist herself. Jill, thanks for being on the show.
Thank you.
Please like, subscribe, and hit the notification button so that more people can get exposed to organized money. Really appreciate it.
A couple months back, we talked to a state legislator and an advocate in Oregon about how they changed their corporate practice of medicine laws because there were a lot of, whether it was private equity or other financiers that were buying medical practices. And I just had this incredible deja vu when talking to Jill on this episode. She mentioned dental service organizations that manage dental practices. In medicine, it's called management service organizations. She mentioned a big dental insurer that is buying up practices. In medicine, it's United Health buying up and employing doctors. She talked about, kind of straw dentists that are nominally in charge. There are straw doctors that are nominally in charge. It's just, it's a playbook, and they have been playing it in medical practices for a while, and now there's this movement to look at dental practices and think, oh, we can just restart that all over again.
And the practice, these industries, the dynamics rhyme, right?
Yeah,
So, and in both ways. So what we're seeing in the healthcare system is pushback
yeah,
as doctors are saying, no, we don't like this, right? And you see pushback on non-competes, you see pushback on corporate practice of medicine stuff, you see pushback on vertical integration. Jill even mentioned the PBM thing in Arkansas, right? Because she's heard about it.
yeah,
And so you're seeing the same pushback starting in dentistry, but actually from a stronger place, right? Because they haven't been fully consolidated. It's still largely an
right.
independent group. And so they are maybe they'll be able to prevent the damage from hitting their industry because of the examples that they've seen in other areas about how to actually push back with
Yeah.
different legal approaches.
It's good that they're getting organized. It's good that there's an alliance of independent dentists, and it was already available and out there. They can now be mobilized towards this purpose. And one of the more, I think, interesting developments of the last few years is how doctors have really gotten organized in this fashion and are really talking about the moral injury that they suffer when they're being told by their, financial overlord to do a certain surgery or not do a certain surgery or whatever. I think you can see that same dynamic in dentists, and as you say, they're starting from a stronger place. All right. Well, we are going to be back next week with another great episode of Organized Money.
Organized money.